Hello, everyone. I'm Dr. Renee Mera. Today, I'll be talking to my guests on a very important, critical topic, the importance and significance of credentialing and certification of Ayurvedic practitioners who hold BMS and higher degrees. Joining me today, we have two BMS Vaidyas. That's Bachelor of Ayurvedic Medicine Surgery, Dr. Sumesh Kaushik, who's also a naturopath, and Vaidya Hemlata Unavekar, and both have extensive experience in Ayurvedic practice. So let me go first to Dr. Sumesh Kaushik. Dr. Kaushik, tell me, how does the BMS degree and higher degrees, higher Ayurvedic degrees, they have MD degree as well, and PhD degree, how are they cut above the rest of those who have just diplomas and certificates in Ayurveda?
Thank you, Dr. Renee, first for the introduction and also putting this program together. First of all, we'd like to thank all of those who came before us and who kept the knowledge and science of Ayurveda alive and this moment alive so that the people of this country and around the globe can be served with this wonderful knowledge, who is so in depth, not only for physical, but mental and emotional and spiritual medicine. It's actually all around. But when we look at the training makes the difference. Their training in the classroom, their training in the field of Ayurveda and medicine, basically the patient contact, makes a huge difference. When you look at the BAMS Vaidya, they have 5.5 years of extensive training. Again, when I was going to school, it was 1 year extra. 1 year was pre-Ayurveda and 5.5 years of training. Now I think is 1 year of pre-Ayurveda and 4.5 years of training. So I think, but again, training is very extensive, Monday through Saturday, every day there are classes. But more than that is the patient contact. When you are learning Ayurveda, you start seeing patients in some institution from second year or third year, where they allow us to go to a hospital where is connected with the teaching institution. So the training is so in depth and so vast that basically you cannot compare that. Even there are some comparison done between the training hours of BMS Vaidyas with the NDs and MDs and DOs. The patient contact hours in BMS much more if you compare those. So that makes the huge difference.
So we're talking of more skills and clinical competencies of BMS.
Absolutely.
Vaidyas.
Yes. And that in medical practice, that is what counts. How many patients you have worked with, how many books you read, that is not the case, because when you see a patient, in reality in your clinic, everybody comes with complications. So when you have a hands-on experience in your clinic under the guidance of a supervisor or a doctor, that's where you learn. And the patient contact is so much in BMS training in India. Yeah. Basically, there's no comparison.
We're talking about academic knowledge as well as clinical experience. That is so very important.
Right.
For consumer safety, especially.
Absolutely, all about the consumer. So our responsibility is just not to get certified, but also to make sure that our ultimate goal is to protect the consumer wherever we are serving. And for that, the training is very important, the knowledge is very important, and also just not only in the field of medicine. So Ayurveda put the nutrition together, yoga, exercise, lifestyle. So basically we call Ayurveda as a science of life, how basically a way of living, how you live. And so our emphasis is not only to treat the sick people, but to prevent the disease. So if you follow the lifestyle of Ayurveda, most of the time our goal is basically not to get sick. So it is a public health in a sense, preventive health in other words. And that is what we need. When we especially look at the modern time, when different estimates are there, 75% to 80% of the US adult population have at least one chronic disease, and almost 50-55% have two or more. So we're living in a society which look very shiny from outside. Inside, we're all hollow. Everybody has some problem. And if we start teaching that science of Ayurveda, or science of life from very beginning, we actually change the lifestyle of our younger generation. Not only they're healthier, but also in the long run, we save not only finances, that's what we ultimately come to, but again, the health itself, not getting sick, the pain, the suffering, that counts the most. And when somebody is sick in the family, it is not that one person, the entire family actually suffers.
I couldn't
So
have agreed more. To maintain homeostasis, go beyond wellness. And that's where epigenetics comes in. That's such an important topic besides genetics, epigenetics, and of course, stress that really is in the
absolutely,
top tier.
absolutely.
I want to go to Vaidyas Hemlata. Tell us, how can NCCBM help over here, BMS Vaidyas and those that have higher degrees, when we're looking at credentialing and certification? Why is it so very important?
Thank you, Dr. Renee. Thank you for inviting me here. And I would like to gladly answer that because we have been doing this at NCCBM for last 2 years. And I came across from many applications who send their applications to NCCBAM to get their BAMS degrees credentialed. And the most important part is like Dr. Kaushik said, India has this 4.5 years of the education, 1 year of internship. So they have the like kind of highest kind of standards of education for Ayurveda in India. And after that, if they do the MD, they even get more experience in a specialized field. But when those Ayurvedic doctors and MDs come to USA, they they do not know if they can practice. They do not know how to start. So NCCBAM is kind of their first step to go to where they will have to get their degrees credentialed by NCCBM. Why is it important? Because we want to look at like any other credentialing services. We want to look at their degrees. Where did they study? Do they have their transcript for 3 years, 3 or 4 years, whatever their coursework was? How was their score? Did they actually attain the degree? Do they have the registration in India? Do they have the experience in India? Because we also ask for the experience letters. Did they practice in India? Are they practicing in USA already? Are they living here for so many years? Their degree, their education, their experience, everything gets evaluated. So they are kind of at a standard level where we can say, yes, these guys have like 4.5 years of training. In comparison, if you look at the schools over here, they do not have that kind of clinical experience. I mean, these schools are great. They teach Ayurveda, and I have huge respect for them because they have kept what Ayurveda alive in this country. And right now we are at this moment is because of them. But also at the same time, we also want to look at the standards of education. When we have different kinds of education in India, different kinds of education in USA, we want to make sure that difference is recognized. Those doctors are recognized as highly credentialed doctors. That's why they should be credentialed at NCCBAM. And right now, I think NCCBAM is the only organization who is kind of credentialing BAMS. Before that, nobody I do not have any knowledge of anybody having BAMS as a credential degree evaluated.
So NCCBAM is, ensuring that they're maintaining professional standards in Ayurveda, as well as that helps for consumer safety. That is so very important.
Yeah.
And also providing advocacy and outreach and research in Ayurveda. So that's all that NCCBAM is doing. That's its mission.
Basically, there are two things which matter the most: the quality and competency.
Correct.
And that's what we are checking, that anyone who is going in the field, we make sure they're qualified, their training is of a good quality, the best quality, and they're competent to actually go in the field and to be called the Vaidya. And for that is what NCCBAM is doing. So you want to make sure when somebody is credentialed by the NCCBAM, anybody can trust them completely with closed eyes. This person has been verified that they have the best education, the quality of their education, they're competent to be called Vaidya. And that's what you want to make sure, because a lot of people actually will come and if their credentials are not checked, they'll just call themselves out the doctor because there's nobody checking.
And I want to go back to you, Dr. Kaushik. It's a segue from what Dr. Vaidyas Hemlata is talking about, and that is because we know we cannot call Vaidyas doctors over here, but Dr. Kaushik, because you're a naturopath as well. So we just talked about the importance of certification. I want to ask you, we have these titles that we're talking about: Ayurveda wellness coach, Ayurveda nutritionist, Ayurveda dietary coach, all these titles. Where do they lead us to when we're looking at consumers who are going to the Ayurvedic practitioners? Are they getting confused? And can these Ayurvedic practitioners with those titles practice classic, authentic Ayurveda in the United States?
That's a great question and a great topic to discuss. So in a regular medical field, we know there are LPNs, then there are nurses, then a nurse practitioner, physician assistant, and ultimately the physicians, and then we look at the specialist. So all of those have importance at that level. But when we are not differentiating, and a person who have just finished, nursing or LPN, and they said calls themselves doctor, that becomes a problem because their training is not equivalent to, not even close to a medical doctor or a DO. And same thing is here when we have a counselor or health coach or a Ayurvedic nutrition specialist. So there are so many coming, and that is what when I saw after coming here, anybody can open a school and they start a new title because there is no overseeing agency. And there is no agency which is going to be credentialing them, checking what they are being taught. Curriculum is not uniform. Anybody can come with their own thing. And with that, when you look at the counselor, yes, there is an importance thing. Basically, they can counsel person, telling that health is important, and the first thing for health is what you eat. So the old saying is you are what you eat. So basically, telling them what is good for you based on your body type or dosha. So we look at the dosha, and so these individuals are trained at the basic level. Like I said, nurse have his own importance. Without them, we can't even run the hospital. So these individuals are important, but that is all they are trained for, not more than that. If there's some, again, I've seen many who will just take the cases which are so complicated, and that is where we need to monitor them. Second thing is practitioner. Yes, they know a little more than that, but the training and especially the patient contact is not there. Basically working with 25 to 50 cases of our peers, all your family members, friends, maybe healthy, and then taking their cases. Of course, I mean, that will give them some basics that they are able to take the pulse. But in Ayurveda, I actually told that we had to take at least 2,000 pulses before you can differentiate. That is not possible here. So training is not adequate to be practicing here. Classical, absolutely not. And that is actually that foundation just takes time, does take a lot of efforts, a lot of studies, and a lot of mentoring. And you need to have good teachers who have practiced and for many years before they can tell you what they're looking for. Because we were not dependent only on the machines. We were dependent upon our knowledge of traditional Ayurveda, where we check the pulse, look at the tongue, look in the eyes, look at how the person is walking, when they're standing, their posture, their skin, nails, hair, and we're just looking at them. So look at the pariksha. It was just not only nadi pariksha, it was just pariksha by nirikshan and parikshan. Basically, we can tell what is going on in this patient. And that education is not there.
Thank you so much for the clarification, Dr. Kaushik. And Vaidyas, let me ask you, what are the goals of NCCBM?
Yeah, so NCCBM, like we said, we are like kind of credentialing BMS with us because that is the highest kind of education. So we want to create that standard of education because it's already existing. We are not inventing anything new. There is some education is going on here. There is some education going on in India. And fortunately, we have many BMS and MD doctors right now in USA who are also practicing along with those who have graduated from here. So to bring along, to increase the standard of education, that is the first goal of NCCBM. And even more than that, I will say the consumer protection is the most important goal here, actually, because with the education of Ayurveda with BMS or MD degrees, we also learn many nuances, many ins and outs of Ayurveda, which may not be taught in the education programs which are taught here in the schools. So we want, because to protect the consumer, we also want to standardize the education. We want to make sure those who are graduating in USA with the Ayurveda degree have the enough knowledge, have that standard of education to just to protect the consumers. That's what our first goal is. And of course, I mean that once we get that goal standardized, we also get like credibility. Basically, once you get the credibility, you also get the accountability. The accountability also leads to the more path, which opens the more pathways for Ayurveda, because once you are standardized, once you are credentialed, once you are accountable, then we can go to the bigger goals like the legal.
And those are the
Getting
long-term goals we're talking of. Yeah.
Yeah, exactly. So we have to achieve these short-term goals first, then only we can think about going to the long-term goals.
But validating the degrees of BMS Vaidyas, providing that accountability, transparency, credibility, those are very important, and consumer safety. And then we go forward with long-term goals for NCCBM. Dr. Kaushik, let me go back to you and ask you about the scope and practice of Ayurvedic practitioners in the US, especially in the freedom states. Can they really practice Ayurveda effectively over there?
See, at this point, there are many states who have been trying. So there are about 40 states who have been trying to get that status of Health Freedom Act. Not successful. 11 states have that. And in most of those states, the consumer have the right to choose a practitioner or a system where they want to go. So in 10 of those, Ayurveda can be practiced. But again, there are limitations. Arizona is one where that Health Freedom Act is only applies to limited level at the homeopathy. Others are not able to. Again, there are people who are practicing there also. And so in the other remaining 10 states, Ayurvedic practitioner can practice, or as a doctor can practice. But again, the scope of practice is limited. So we need to be looking at, we do not diagnose, basically. Again, if we stay within the limitations of Ayurveda, great. But we can't give a diagnose, or we cannot order the blood work, the labs we cannot order. So in that case, we have to work with other consumer, and that is what our long-term goal is, to get Ayurveda license in this country. But in 10 states, yes. Other states also, there are individuals who are practicing, as long as we do not do anything, or we not take serious patients, like we just can't be treating cancer or something very in depth. But if we stay within the limitation, not to diagnose, and then we are not prescribing anything outside of our scope, not treating anything out of our scope. Physical contact also a limitation. So that is one of the reasons many of the Vaidyas are getting under training. But again, I'm telling one thing from my own experience: just pure Ayurveda. If you're practicing traditional Ayurvedic medicine, you do not need anything else. It's the knowledge and the material we can cover and the service you can provide is enormous. I mean, you cannot find anything. A combination of package of nutrition, lifestyle, all these supplements, if you find a good quality, great. That is actually what I find. So yes, in most of the states you can practice if you just practice Ayurveda within scope without actually giving a diagnosis and then using the word. Terminology had to change. In some state, we don't call patient a patient, is a client. So with that, if you're keeping that in mind, then definitely you can practice, yes.
Yeah. At this point, we can't say we are diagnosing, we're treating, we're prescribing medication, because that's not accepted this time. So legal recognition is what we're looking toward at this point of time. Then we're looking at the regulatory frameworks. We're looking at the impact of state regulation that you just talked about. And then we have this dynamics to be played out, how to have Ayurveda accepted as a healthcare discipline in the United States legally.
Absolutely.
So where do you see this going? Both of you, starting with Dr. Kaushik, and then I'm going to go back to Vaidya Hemlata.
See, that is why the NCCBAM is important, because once the credentialing is there, certification is there, then it basically establishes a ground. These people are well qualified. These are competent, and these are not herbalists. They know a lot more than that. Again, we have seen the Ayurvedic doctors, especially in India, and here also many who have combined their training with other things. They are treating and curing serious condition. I mean, basically, look at the condition which in modern medicine there's no cure, is only treatment. And then they come that basically my doctor or my expert told me this, and I'll be living with this entire life, finding out after few years they are completely well and going back to work and productive citizens. So that is there. And so that is what BA basically, they're qualified for. But NCCBM have chosen that path. Let's put all this together and make sure we certify qualified people so the consumer get the best of everything. And when that is established, then these consumers can also talk to their legislatures. Listen, this is what we need. So not only in health freedom state, but in all over the US. Eventually, we want to make it a licensed profession where the consumer, the public of this country, can get basically options of choosing while they're choosing a Ayurvedic doctor or a naturopathy doctor or a doctor of osteopathy or chiropractic or MD. Everyone can work together because there's no one system which is complete. And so when we work at the integrated system, definitely there's a place. Yes.
Vaidyas?
So I would like to say all BMS or not BMS who have studied here, I would like to say to them, when you practice in USA, follow the law of the land. Read the Consumer Protection Act that is applicable to your state, where you are staying, where is your practice at. Read the law carefully, stay within the limits of the law, never cross the limits, because consumer protection is the highest priority and should be the highest priority of any Ayurvedic doctor or any Ayurvedic practitioner, let's say. And NCC BAM is that's what we are aspiring for. We want to help BMS, MD, or non-BMS, all of them, to follow this practice legally in America, and they should be well within limits, and we can help them if they don't know how to go for that. We have steps to follow, and NCCBM, like NCCBAM, not only credential them, but they also guide them how to do that. So I think that's the biggest role of NCCBAM here as well.
Well, thank you very much, both of you, Vaidyas, Hemlata, and Dr. Samesh Kaushik. And I think all of us agree on one important thing, that is the whole Ayurveda fraternity has to come together as one solid block, whether we're talking about credentialing and certification of BMS Vaidyas and those with higher degrees, whether we're looking at professional standards of education in Ayurveda, whether we're looking at consumer safety, public awareness about these issues, for the well-being of all, and getting this as a licensed healthcare discipline in this country. These are the goals that we should all be striving for as one solid block. Otherwise, we will never be able to get what we are looking for. And that requires unity, cohesiveness to move them forward. We're looking at wellness, we're looking at preventive care, consumer safety. There's the importance of credentialing and certification. Thank you all.
Thank you, Dr. Renee. That's very well said. Thank you for having us.
Thank you. I'm Dr. Renee Mehra. Stay healthy, stay positive, and thank you for letting us be part of your busy day. Namaste.